welcome to Mormon Sex Info. This is Natasha Helfer Parker. I'm super excited to have, I think, a very relevant and important topic today, which is going to be talking about how we can manage situations when there have been children and minors, especially like 13 and under, who are, acting out in sexual ways with siblings, with themselves, in the home situation. I oftentimes get questions from parents or leaders that, have these types of concerns. They're somewhat common. That doesn't mean they're not always problematic. How do we go about kind of, understanding this topic better so that we can help our kiddos in sex positive ways? So that's the topic today. Before I get started, just a few announcements. So Mormon Sex Info is a podcast that I run kind of on my own. All the costs are on my own, et cetera. So there is a $35 subscription rate per year. Thank you to everybody who, subscribes. There's also a way to kind of get downloads, for like a one-time cost. And eventually, archived ones will all be kind of for free. So it's just a way to kind of support the podcast going forward and keep it sustainable financially from my perspective, as far as the time and the cost that it takes to run something like this. So for everybody who's a subscriber, thank you so much. And please consider that if you're not. I have started doing these on Facebook Live as well, so that's another way that you can access information. So without further ado, I'd like to present our guest. So today I have with me Amy Hammer. Amy is a colleague of mine through ASECT, which is the American Association of Sexual Educators, Counselors, and Therapists. She is a certified sex therapist as well as a licensed clinical social worker. She works here in Kansas with me, and I met her through conferences and such. So that's always exciting when you get to see somebody that's not too far from you. She works about half an hour north of me in a town called Newton. Prairie Creek is, I think, the Prairie View, sorry, is the clinic, or is it a hospital setting?
Yeah. Hospital and community mental health center. So huge, 65 years being here. So
yeah, it's a huge entity, and it's a huge resource in this area of Kansas. So for mental health. So I'm so happy to have you.
Hey,
why don't you tell us a little bit more about yourself? What am I leaving out?
Well, yes, I'm in the middle of Kansas, almost the center of the U.S., but not quite. But and I've been here at Prairie View for almost 16 years. I've been in mental health almost 23 years, and I'm still 25, but right. I know, I'm in denial there. And I work with ages 14 and up, and generally, and I see families of all ages included, all issues. And yeah, it's a good work here and lots of resources within our agency to just in a community approach as well. So, and it's unique here too, because we're in a Mennonite area. The Prairie View was started by the Mennonite, like I said, 65 years ago. So we still have support there as well. And that's been an interesting learning curve for me. I was not as familiar with the Mennonite religion and the churches.
Okay, wonderful. Yeah, that's really interesting. I always like to have that intersection of different values and how they're similar and how they kind of can be unique as well, and kind of these religious communities, which obviously Mormonism is one of them. So, all right. So the reason why we decided to do this podcast is so we're both part of a listserv, which, all of these sex therapists are part of it, and they can write questions in, and we can all kind of help each other and give advice or resources. So it's kind of a nice resource for us. And in one of these posts, a therapist had talked about, kind of a generic situation where I believe it was an 11-year-old male had been sexually acting out with a younger sister, I think like maybe 2 years younger, was now being seen and treated like a sexual predator, and the family was all up in arms. And there was just a lot of concern about how the treatment was going and whether or not it was a sex positive treatment, and where to like lead the family as far as resources from there. That's my basic recollection of the case. And so I think it begs this question of what is normal sexual exploration amongst siblings, cousins, even next door neighbor friends. They're all in a similar age group. And where does that line cross to maybe more concern, where parents need to be a little bit more adamant about receiving treatment or not seeing it just as a normal, playful thing? And whether or not it's normal, also, when is it harmful, right? So a younger sibling, I know that just in my work with adults, sometimes I'll have a person who will say, yeah, I remember, my brother or my sister would touch me or masturbate with me or rub up against me. There was maybe only a 1 or 2 age difference, but it left me feeling, worried and yucky, and we've never talked about it. So even though I would consider that kind of normal behavior, that doesn't necessarily mean it didn't have some consequences, right? So, and I often talk to families about this idea that our sexuality bumps up against each other in our homes. Whether it's your kids run into your bedroom when you don't want them to, or somebody sees somebody naked, or somebody walks in on somebody masturbating, or people start being curious together. I mean, these are things that are probably going to happen. We don't talk about it hardly ever at all in our culture. And then what do we do with it when it comes to fruition, and in a way that it doesn't kind of over exaggerate the problem, but doesn't minimize the problem either? So that's the big mess I want to talk to you about today. Is that a good a good intro?
It's a big intro.
It's a big intro.
Big topic, yes, yeah.
So where would you like to start?
Well, I didn't mention that I've worked with, we have a group here for adolescents who have sexually acted out. And I don't like to call them offenders, but the society likes to. And sometimes they end up on a registry, and that, at least here in Kansas. But I used to work with that program for a number of years, and I haven't directly, maybe 5 years. I do work with some developmentally disabled adults related to sexual acting out. And that's a different specialty in itself too. So at least I have those experiences. And then also working with the parents of children who've acted out, or even just exploring. Of course, we have to help them understand the differences. I think it's important to look at maybe grouping, at least for now, categorizing different levels. Sometimes that helps us to begin understanding what we're looking at. What's normal, what's excessive or unhealthy and very concerning. So would that be of help to do it that way?
Yes, please. That would be very helpful. And I'd also like to know, what is your thoughts about why you do not like to use the word predator when you're dealing with minors?
Oh, yeah. And if so, kids are still growing and developing, and hormones are starting to puberty stages. So it's normal to be curious and have those feelings, arousal even. And so I think that if they sexually act out, you have to look at what caused it, what led up to it. Interestingly, most of the times when I was working with adolescents, with the males, they knew that it was probably wrong, whatever that meant. And even though nobody ever said, don't do this, somehow there was a sense of, I've got to keep it secret. And that's where coercion may have come in at play. But the kids may not have known it was illegal in that sense. And it just caught me, just an interesting observation. And working with teen girls, that was a whole other ball game and I had more problems than working with the guys. So just
in what regard? Like what comes to mind?
Not as many resources. More of the girls were in foster care, and more of their behaviors I would classify as more perverse. It went beyond the typical sexual play that you might encounter, where it was quite just sometimes alarming in some ways. And I don't know if I want to give any examples because they're quite graphic. Yes.
Yeah. Right.
Yeah, and it just shocked me. And there's just some of the families of these girls would not take the girls back to their homes. They stayed in foster care, and there was usually other behaviors such as shoplifting, theft, and usually there was a past history of sexual abuse towards them or other types of ongoing abuse as well, physical or verbal, where if there happen to be guys in foster care in our treatment program, I probably 90% of the families were working very hard to get that child back in the home. And this is ages 12 and up, usually in that range. And I just, to hear those messages from the parents to say to the foster care system, we don't want our daughter back in this home, not after she's acted that way. I just couldn't wrap my head around that. So, but that was just my experiences here in this one area. I don't know what others saw in their practices related to that.
Okay.
But,
okay. So going back to your idea of maybe helping us group where, what's maybe normal, what's concerning, and what's definitely moving into the realm of predator, illegal type of scenarios, and even the ages, right, of when that.
Well, ages I think can be certainly 12 and under, probably 5 and up, 5 to 12 range is this continuum of trying to group normal to concerning. So the normal range, like would be the voluntary, exploratory in nature, and it's based on the discovery and wow, what's this my body is doing, and sometimes it's even being silly about it. Brother, he has a penis, I don't. I have a whatever words the family might use about their body parts, and they might giggle and laugh about that. And mom and dad say, yes, that's right, and it's not necessarily a problem. And they may feel embarrassed, but there's not going to be fear or anxiety with it. If there's fear or anxiety starting to show up, what's that about? We shouldn't hopefully not feel anxious or fearful about our bodies and what's going on. So, and then if also not to have shame. If there's shame involved in exploring, where's shame develop in a family, usually out of secrecy, I think, and or for other types of abusive situations occurring. But shame is a difficult topic to discuss with families too. I don't know if you experience that in your practice.
Oh yeah, no, for sure. I think what I'm hearing you say then is that a big part of sex positive exploratory periods for especially younger children oftentimes includes the reactions of parents.
Oh,
so if they can normalize, yeah, that's right, or no biggie, yes, this is your body. If they're naming body parts, sometimes shame can start even with very simple things like not naming body parts, ignoring certain parts of the body, kind of giving the covert message, right, that we don't talk about that. We don't talk about certain parts of your body.
Right. And, an example was if we say down there, we don't talk about down there. I just think as I was a child, I'd probably look at the floor. Well, why not? I just could never understand some of these weird rules that were set up. And I would just blurt that out. Well, what's wrong? I mean, what about my feet? I like looking at my feet, and but eventually through that type of language, I think kids typically figure out, yeah, we can't talk about down there. And that's developing that shame level, which is sad. And that's hard to break, to retrain people's brains later in adult life about that shame, to get rid of it. So, but it's typical for baby infants even and children to begin, with skin touch. That's a primary method of finding out learning about their bodies. So of course, if they grabbing their feet, and pulling their toes up to their mouth if they're that flexible, and touching their genitals even, that's not because they're trying to be sexual. That's just learning about their body and what it's doing. So that's quite normal.
And even if they're doing that to a sibling, like maybe in a bathtub or things of that nature, are fairly normal. Just curiosity at the small, like what are we talking about? Like 2 to 6 years old?
Sure. I think if you have a 6-year-old though who's voluntarily only doing that, I think that would I would say, if you have an infant, a toddler even, uh, I personally would just keep an eye on that and engage in conversation. If they were just focusing on the genital area, I wouldn't want that. But if it's a caring touch or helping to wash the sibling, that's would be okay. So
And
uh,
examples of how a parent could redirect if they are curious about touching the genitals of their siblings.
I think I would ask and say, do you have, are you concerned? Are you, what's going on there? Type of question, and then just engage conversation and see where that goes to. Just developing a comfortable level of conversation, our private conversation within our own family versus I don't want to make it secretive or shameful.
Right, right.
Mhm.
So teaching boundaries, like this is, we all have our own private parts and we
Yeah.
don't touch certain parts of other people. And
Yeah. If the toddler is pushing the 6-year-old's hand away, and to acknowledge, okay, your sibling doesn't want you to do that, you should stop. And if they're asked why, or if they get aggressive, I would say I would have an issue there to deal with.
right,
Want to stop that behavior and talk about respecting that natural boundary. The toddler may not be able to say why they're uncomfortable with it. Just pushing their hand away is enough, or saying no. That's
right.
quite natural and okay.
Okay, so do you want to keep going as far as just kind of spectruming?
Yeah. It is normal if masturbation too. I was going to say if it starts at a very young age, I mean that can be quite natural too. Most children have learned about the different parts of their bodies by ages 2 or 3, and they may not realize that masturbation, whether just different levels of that could occur, if they're reaching down into their pants or under a skirt or something, and that's quite natural, but maybe not appropriate in certain settings. So of course we would set boundaries there. But then of course if a 12-year-old or 13-year-old is doing that in public, there's something developmentally that's probably occurred. Usually by that age, kids can pick up on those social cues. Not okay.
Mm-hmm.
So, but like I think the next type of group would be if where it would become more concerning is if that their sexualities, and this flows along with the 12 or 13-year-old who may be masturbating or touching their body in a social setting, is where it's not in balance to their age range or their peers, with their peers too. So that would be, if some of those behaviors were occurring, then I would ramp that up a little bit as to more concerning. Let's talk about what's going on and what their awareness is. Do they have the ability to learn those social cues, and do they have the ability to follow some family values and rules that are being put into place? And
And
so
these are kids that you're saying might like masturbate in public or might do things in a public sphere that wouldn't match what the other peers are doing.
correct. Yes. I mean, sometimes that might be, if uh, they're scratching, their butt, or if they're picking their nose. I mean, obviously at that age, if you're doing that, kids, will quickly and generally will be saying something to them, or maybe not friending them and
Mm-hmm.
avoiding them, and it can cause quite a lot of stress if this child doesn't pick up on those social cues. Okay, these other kids aren't liking this. Maybe I should stop. And sometimes those behaviors may increase um, because of anxiety. The child may not be able to, in their mind, be able to recognize that, but the anxiety there, will build, and the stress and they may actually use that to help calm instead of stopping the behavior. Actually masturbate more or increase whatever sexual behaviors are going on.
So the anxiety might make the situation worse, is what you're
Yeah,
saying, instead of
yeah,
better.
yeah. Instead of raising awareness of like, oh, this isn't okay. So
Right,
yeah,
right.
yeah.
Yeah. Okay.
And if also you have to look in that group is if there's coercion actually going on, if they're trying to be more secretive and with their peers or siblings too. But they may not be trying to threaten them or hurt them, but they may try to coerce them in certain ways. And sometimes at that phase, they may be reenacting if there has been sexual abuse that has occurred. It's sometimes a child will reenact it and carry it out with another sibling or friend or such. And that would be, you may not know that that has occurred. They may not know that it was abuse that occurred, but they sometimes will reenact that. And that would raise some flags as well.
Yeah, and is there any statistical knowledge about, because I think that's the number one thing I hear from parents that are very afraid is, has something happened to my child where now they would be acting in this way? So do we have statistics around how often kind of sexual play amongst young people is directly related to sexual abuse, and how often it's just kind of just it is what it is?
When I have looked at that, the ranges, there's the percentages are all over the place, and the way the research may have been set up, the results are varied, and so I've not really relied on that so much. But I think that you can look at if generally if a child is reenacting or at a 5-year-old age, if they know what intercourse is and or other types of sexual behaviors that generally are with adults, where did they get that information from? And of course, it could either have been that they were um, sexually abused or if they witnessed, whether it's like, I mean, it could have been just simply walking in on mom and dad, and they parents may not have realized how often they have done that, which of course could occur if it's the media, or because of our technology. And, kids are having a cell phone access at younger and younger ages. So if their peers are watching something on the phone and they see this at school even.
Mm-hmm.
So it could be a number of reasons. It would just be a matter of hopefully talking to this child, seeing if they're willing to explain or understand. And if not, if the child denies, I don't know, which is a common answer, I don't know, at least then begin educating. Okay, when is it okay to do that, and who with, and at least opening that door, because eventually maybe they'll disclose where they got that information.
Okay.
Yeah.
All right. So, probably the most common things that come in to me as adults, again, because I mainly work with adults. So, but the most common kind of confessional that I hear from an adult is something like, when I was 10 or 11 years old, I would, dry hump my sister or my brother, or we would practice kissing together, or we would get naked and, rub our bodies next to each other, or we would, and this is typically in many of these situations, like I said, a 1 to 2 to maybe 3-year gap. It's like the siblings kind of right next to each other, or cousins, on sleepovers or things of that nature. And usually the behavior has stopped by the time that they're 12, 13, 14, mostly 13. So 13 and under. And they're coming in extremely distressed about this, was, especially if they're the older child, was I a predator? Did I, sexually abuse my sibling? Or if they're the younger one, what was this about? Was I sexually abused? Oftentimes they have good relationships with these people still in their lives, but they've never talked about it, right? So I guess this is kind of where I see that middle ground, like they're not 5 and super innocent, right? And they're not 17 and, kind of at a much higher level of responsibility, especially with, when I think of kind of bigger age gaps, that's more concerning to me, like, a 15-year-old with a 5-year-old, or,
Right.
that can be a lot more concerning. Where would that type of middle ground situation happen?
Well,
Or how would you categorize it? I mean,
well, I would say probably the first two that we've just talked about is that's pretty common, I think, and normal. What's more concerning is that their possible shame that they have coming in as an adult, carrying it around for how many years, and being worried, did I abuse somebody, or was I abused? And so it's a matter of, certainly gathering more information and finding out how does that affect them now. And sometimes people are able to leave feeling relieved, knowing that, okay, this was kind of a common exploration, and sometimes they're okay with it from there on, or they'll come, like if I have that experience with clients too, they may have other questions that come up, and it may take a little while for that to kind of slowly dissipate with the shame. And there's no percentages on that. I think that I could say a great majority of adults probably have some level of experiences with that, especially if they had a sibling or close cousins who were involved in their lives at a younger age. So I think normalizing it helps, and then saying if you felt coerced or tricked or such into this and didn't feel like you could say no, how's that affecting you these days too? Because, if it was 20 some years ago, it's, we may not be able to involve the others at that time. And most people, in my experiences too, haven't talked to their sibling or cousin about it again. It just, which is interesting. I don't know if it would be, I would love to have a conversation with some people who did talk about that with their siblings and what that was like, but most people aren't comfortable with that. So,
yeah. Okay. And then, so what's the last kind of, kind of way of categorizing where maybe there is larger concern? And
I would say, like in the third group would be as if there's habitual behaviors, extensive participation of adult type sexual behaviors. And there it would probably, if it expands into other children, besides outside of, whatever that home environment is, and also try this extensive work to keep it secret, and not to let others know. And they don't necessarily, they may not necessarily be doing it for the sexual experiences or sexual pleasure. And it may just be, again, repeating what they've seen, what they've experienced in the past as well. And there may be more resistance to answering questions if an adult family member has found out and wanted to find out what's occurring. And there's probably more shame associated with it, and more anxiety too. So, and there probably, in order to manage that and treat that, there's probably should be a professional intervention at this level. And especially if this child would be using sex to develop peer relationships rather than other child type play. That's something else that would be important to assess if that occurs. And there probably is, if there's coercion or forcing another child to, that would be more extensive problematic area in that group. And then the last group is if a child is actually harming another child or person with their sexual actions, their sexual behaviors. And they may be more pervasive and secretive in nature. So, and some of the recent research I read on this, and I was trying to find it this morning in preparing, is that the more extensive problems that occur in this group are usually in families where the child is, there may be neglect occurring, or the child's in foster care. They're not being raised by the primary parents. They might be in another family member's house. There's a lot of chaos and disruption in where they're living. So that's a common background area too for the child. That doesn't mean that a child who's in that system is going to actually do this.
Mm-hmm.
It means that their experiences and exposure to a vast environment, chaos, has created more possibilities of seeing and experiencing things that most children at that age shouldn't. So does that make sense how I say?
Yeah. Yes, because you don't want to stereotype an entire group of people, and
Yes,
at the
yes,
same time, there's others too that wouldn't be in those kinds of situations and would still act out this way too. So these are all just generalizations,
yeah.
statistics. Yeah.
What real quickly too, oftentimes in this more problematic group is that the child may lack compassion or empathy for the victim, and for the other child or sibling or peer. So that's something that's been observed frequently as well. So
Okay. So let's switch gears then and say what so let's say the parents or a teacher or a church leader or somebody kind of catches wind of something that they're concerned about. What are maybe some of the best ways to, first of all, figure out, okay, is this something that I can just kind of talk through with my child? Is this something that I kind of keep within the family system and it's perfectly appropriate to do so? Or when do I need to get professional help? And even the third thing is, when do authorities need to be involved, right? So these are kind of questions that I think are very difficult for people to gauge. At what point do we involve what resources?
And that's a topic in and of itself too, that I've had many conversations about. If it's a group one area, if a church leadership walks in and sees two children, it seems like an innocent case of playing doctor, playing house. Well, I would probably want to engage the parents and discuss and let them know, and what their comfort level is to talk with these children, or maybe you could decide to not let the children that you saw them. Let the parents handle that, and because if it seems like it was healthy and exploring, but church setting at least wasn't appropriate there. If it's something where it was actually the abusive nature, that's a tough one in a church setting, because oftentimes that information may not stay private. It's hard to keep that from others talking just within the church. It can quickly spread. So how do you contain that while respecting privacy of the family and the child, but also setting boundaries so it may not go outside the church? Does that make sense there?
Mm-hmm.
If and many pastors these days are also now, I think in Kansas, mandated reporters also are required to report. That's something new I just learned as well. But I have also heard where churches, and they will not report if there has been abuse, and because they don't want that to destroy the church, and for people to leave. There's all those types of concerns, or they don't want it to go into the media. But I think it can be handled sensitively and within legal realms. But if somebody has been harmed, it should be reported so we can make sure that they're protected. So not as it sounds easier than it actually is, though.
Yeah, I think it is hard. It's hard to know when is it exploratory, especially if there is even a slight age difference. At what point does a child have the capacity to say, no, this is something I don't want to do, when they're looking up to an older child, or something like that, even though they both may look like they're fine. At what point is it something that, and I think, if people are wondering or curious, I think at least a good place to start would be with a professional who is trained in sexuality, who has a sex positive approach, who's not going to shame your child or exaggerate the consequences of what needs to happen, because then you have an outside opinion of whether or not authorities should be involved. And I think that can also be protective for the parents and for church leaders, so.
Excellent. I think that's a very good plan that way too. And it would also be advised to develop, I would call it a safety plan of, let's say, the one who initiated all of this. And sometimes it can be the younger of the children too. It's not necessarily the older. And to develop a plan of like, maybe you need to monitor this child, that they not have responsibilities of caregiving for the younger children in a church setting or even at the home, and which is tough because sometimes we need that 12-year-old for a little while. We step out to get the groceries from the car and bring in, and put them away. And we have to figure out and get creative on how to build a time of trust and for that child to learn some those healthy boundaries and see them practiced for a certain length of time too.
Right.
And I think that can occur in a church also. You can have a certain group of people to help with monitoring that and teaching the child how to self-monitor too.
Well, it sounds like what you're saying is that very few of these cases necessary. It's not like children who have these types of explorations or issues, automatically go on to become kind of predators or assaulters. Like that's the correlation isn't there.
Right. Yes, that's true. That's sometimes it's with children because it is a developmental level. And if we have a sex positive role, we can help, I'll say, correct that developmental level to develop those healthy boundaries. What's it look like to have healthy relationships, and when and where, and when is it problematic too? So yeah, that does not mean they will go on and harm others. No, but having that safety plan in place to help monitor to still allow the child to be in a healthy environment with the church members, the congregation, and in their own home too. So,
well, there's like a few themes that seem to come up as you're talking. So one is sexual education from the get-go. So it seems like some of these things could be avoided if people are proactive about sexual education with their children from the get-go, both from talking about anatomy, talking about boundaries from a very early age. It also sounds like another theme is possible developmental delay. So if you've got a child who is maybe somewhere along the developmental range or learning disorders or anything of that nature, they might struggle to be at the same level of their peers in regards to learning appropriate boundaries. And then third category is there something that's either happened to them or a chaotic environment where there's trauma or abuse in the family system where now this child could actually be acting out in a way that's been sexualized. So there's like lots of different possibilities.
Yes. And that's where a professional would come in hand to be able to help determine, all right, what are those risk factors, what resources could be put into place, and to explore that with the family, and possibly even with the church. I mean, I've been involved in as a therapist here to engage with some churches to set up a small group to help monitor and provide that safe community for the whole family, for the ones who were, if they were victimized, which is that's a big label to have for somebody too. But if they were harmed in some way, and then also to help manage the young person developing and to continue providing that sex positive pathway for them. So,
well, and I really appreciate your comments about the importance of churches not necessarily keeping this in-house, that they probably need some resource, whether they're collaborating with mental health professionals or sex therapists in the area that can offer some type of either trainings or collaboration, like you're saying, or be able to refer families to certain professionals in the area.
Yes.
Because even in the Mormon church, I've seen that be a common theme as well, where, a lot of times the first line of vulnerability or disclosure is to a religious leader. The family is desperate or, upset, even if it hasn't happened at church, even if it's happened at home, they'll often go and talk to a religious leader about these things prior to a mental health professional or even going to the authorities. And if that ecclesiastical leader keeps it in-house for a variety of reasons, and I think I agree with you that sometimes it's the protection of the church itself. I think sometimes there's even an intention to protect the family or the child, like maybe this isn't such a big deal. We don't have to blow it out of proportion. But in that process, a lot of things can kind of slip through the cracks, And so I think it's just always a good precaution for leaders to be more leaning towards, this is probably an area where I could use some collaboration.
Yeah, and I think definitely a collaborative approach with somebody who has that training. It has the better side of outcomes altogether too, and it's not going to happen overnight. And if I hear somebody who minimizes this and say it just happened one time, why are we making a big deal? Red flags will, or at least yellow flags will go up with those types of comments, and so you don't want them to go overboard either. It's a tricky balance with that. You have to sometimes pull in the reins with people before they would do way too much, but waving it off though is not the best thing to do either.
Also problematic. Mm-hmm.
Yeah. But if you have somebody outside of there who we can build a relationship with, if it is a therapist in the community, and get to know them and their style and how they approach things, that can also build just that network to have, and if something has occurred too. So yeah, I think that's it. And it takes, sometimes you have to develop a plan or policy to put in place. So if something were to occur, in the worst case scenario, we have a backup to, okay, this is where we're supposed to contact so-and-so, let's do that, and put something into place to help move us along here.
Right.
Yeah.
Yeah, no, I like that. Go ahead. Sorry.
Yeah, I was going to say sometimes if there, another problem that I have seen is that, and I struggle here momentarily too, because I think about my own faith system here of, our faith system is that if somebody wrongs us, we try to work through that relationship, and we learn we're supposed to move on and we forgive and such. And one of the problem areas, I think, is if a church says to the person who's been harmed, even if it's a child, but let's, you have all ages, even the families of that child, we say, you need to forgive so-and-so and move on. And that's a process. And my theology is that forgiveness is a process, and we should not force that onto the victim or their family. If they're hesitant about re-engaging with the church, if they don't feel safe or they don't think their child is safe, we need to address that. And but then that doesn't mean kicking this other child out who has done some harm. How do you keep the body of the church together when when that one body, you know what I'm saying? If somebody has done that harm, that's a whole developmental stage for a church in itself, to stay strong and sort all that out. That's a tough one. That's a bigger conversation than what we have today.
Yeah. No, and I've been involved in cases like that where it can be very tender feelings on both sides of that equation, for sure.
Yes.
Where a victim's family can feel like, you don't care enough about our safety or my child's safety to address the issue because you're still allowing, this other person to be in our congregation, things of that nature. And then on the other side of that, is like, where's there room for progress and learning and, boundaries and not shunning, especially minors. I mean, when it
Yes.
comes to adults, I think there's a different conversation there. And even, there can be more strict boundaries in place for sure. But when we're talking about minors and things that have happened, it does get a little trickier about how to keep it inclusive
Right.
and yet protective.
And that's where more conversation, ongoing conversation, trainings, understanding about this, because sexuality is a part of our whole lives. And when it's not about sexuality, but it becomes to sexual abuse or such, definitely it's a bigger dilemma. And again, involving those who have that training, it can only be productive and helpful in the long run too, and respects to the church values, the theology too. So, but yes, we're all sexual beings. So when we want those children to grow up to be healthy sexual beings too, and we're the key figures to help them develop that. So let's continue being more educated about it and understanding of it. So, all right, got on a soapbox for a minute there.
No, that's sometimes soapboxes are necessary.
Yeah.
Yeah. So is there anything that I'm not necessarily asking you about that you were hoping to share today as far as information or statistics or anything else that maybe I didn't cover?
No, statistics are a tough one to quote, because it just depends on what the research was really set out to do. And, just to make sure that if a child has sexually acted out in a way that causes concern, alarm, of working hard to not assume that they're going to continue doing that. Let's not make them a perpetrator in our head. Chances, I mean, there's only small chances of that actually continuing. But if we work towards developing those healthy sexual boundaries and relationships and behaviors, that increases the chances that they'll do okay as an adult. Yeah, I will say this though. It's hard to track if there is recidivism, especially with the adolescent programs. There, at least the last time I checked, there's no research to follow up with the kids who have been in treatment and have completed it successfully, what they look like as an adult. And there's no long-term studies on that. But I think what you can look at is those who have been caught as an adult, who have sexually offended and are in the legal system. I've not seen research that says, well, like 20% of these people were in treatment when they were children. What happened there? There's nothing. Nobody has. I haven't heard comments about that. Does that make sense? How I
yes.
So yes, there's some risk factors, but I think that the trainings that go on by the professionals, they have and we continue to develop different strategies to teach the children and families. I mean, that's the best method to go. This is through I think the mental health system to recover what has occurred if sexual behaviors have become problematic. So
yeah, I would second that. I think that's a really great place to start, especially if there's any type of confusion or question as to whether or not there's a seriousness of the situation that you're not sure how to handle. So,
and go ahead.
Just making sure that professional is trained correctly, because as my audience knows, is that especially when it comes to sexuality, there can be a lot of professionals out there that are not very trained in sexual matters and that can impose their own biases or their own fears or their own anxieties onto your family situation. So ASECT is a good resource, aasect.org. Do you know of any?
I'm sorry, I was going to say ATSA and the Association for the Treatment of Sexual Abusers. Now, I know I said earlier that, for children, I don't categorize them as perpetrators and such, but that is the organization that is looked to, I think I said internationally, for they do research, they have publications, they have conferences, and to train professionals and many other professions too, to be probably the more advanced go-to people. I mean, there's not a certification program like with ASECT, but you can join and be a member and have access to different resources. So here at our agency, we have that membership, and we do require certain trainings to go to stay on top of that with the folks involved in our groups. So.
Right.
So that's if the therapist clinician is familiar with that, has attended trainings and also a sex therapist, that would be a plus too. So if they're not familiar with that, what is their training?
Right. Okay, good. So I'll make sure and link to those types of organizations so people know where to go look. Well, great. I think that that's a really good way to kind of conceptualize these issues. I know it brings parents a whole lot of just, anxiety. It's interesting how we're all sexual beings. We all lead sexual lives. Like I said, we kind of bump up against each other's sexualities along the way. And yet the conversation is, just not happening. We're very fearful. I think our children's, sexuality brings about a lot of anxiety. And so it's just hard to know how to handle some of these situations when they come up, or how to make sense of them or meaning of them. And I really appreciate all your thoughts. It can be really helpful, and at least helping. I think information helps quell anxiety and then knowing where to go to get that type of help you might need.
Yes. And I think that our children exploring their bodies and sexuality can be just fascinating too, as we watch them develop and grow. I had a friend who taught sex ed. If I may, just a quick story. That's fun to see a child be excited to. She taught this is back in the 70s, probably sex ed to second or third graders. So I don't know what school system that was, but that's what she did at that time. And she was describing the anatomy of males and females. And all of a sudden in the back of the room, she heard a little boy say, "I found it. And so, of course, there were several conversations to have with that, but just the pleasure from that little boy's voice and the excitement to be able to teach a child something healthy, and I'm sure she had several conversations with him after that. So,
yeah, right.
I found it. What a wonderful thing. So
right. Yeah. Well, and I think to your point, keeping our tone casual, keeping our tone very matter of fact, especially with smaller children, not being like, "Oh my gosh, your face is all." It's more like, "Oh, okay, well, this is what that is, and these are the places we can explore that, and that actually belongs to that other person. So maybe, keep your hands on your own." So it's that kind of stuff can be helpful in just those initial boundaries, that initial information that can be helpful for kids.
Yes. And there's lots of good resources out there too that can in itself be several hours worth of conversation too. But so we're not the world isn't shutting out healthy sexuality as much as it used to. So
yes.
we can be well armed with information. So
good.
Yeah.
Thank you, Amy, so much for joining me today. I can't appreciate it enough. I know your time is super valuable, and I co-taught a class with you at one of the local universities. You're kind of all over the place. So
I forgot about that too. Thank you again for that so much.
Oh, that was so much fun.
I'm supposed to take you for lunch for that, aren't I? Okay.
We'll have to get together. All right. Well, thank you, Amy. Thank you, listeners. Again, please feel free to make questions or comments on the threads. I can always address things in future podcasts. Also, consider a subscription at mormonsexinfo.com and help pass the word along. Like the Facebook page. That's a great way to help me, or even give us a review on Facebook. That's another way to support the work that I'm doing. So I appreciate all of you who listen, and hopefully we've had another valuable topic that will help you lead a sex positive life. So good day, everybody. Take care.
We took the long road home, turned minutes into miles, and as the evening traveled on, the sunset bathed your smile. We stopped beneath the desert stars, wrapped in each other's arms. Was as simple as I love you, an ordinary, extraordinary truth.
A trail with tears, pain and sorrow too.
But through every storm we traveled on, like lovers do. And if sometimes we fell apart, we always came back home. Was as simple as I love you, an ordinary, extraordinary truth. Some people say love is blind and forever is too long. But I see your eyes in every sunrise, can't imagine life alone. Let's take the long road on together until we're gone. Want you by my side till the day I die and into the beyond. It's as simple as our love is. That's how I wanna go, all wrapped up in the arms of our extraordinary, it's nothing ordinary love. Ordinary, no, it's extraordinary love.